Hi, everyone. Anthony Gucciardo here with the National Kidney Foundation, and I'd like to welcome you to another edition of the National Kidney Foundation's Facebook Live series. For today's program, we'll be talking about what may well be the most searched term on our website, kidney stones. Lucky for me, I'm joined by some very smart people who happen to know a lot about this subject. So, from the Icahn School of Medicine at Mount Sinai, we have Dr. Michael Palese. Dr. Palese is a urologist who specializes in the treatment of kidney stones. Also joining us is Dr. David Goldfarb from NYU Langone Health. Dr. Goldfarb is a nephrologist, otherwise known to us as a kidney doctor. Finally, we're delighted to have Art Aronson. Art has a personal experience with kidney stones and is gracious enough to share his story with us today.
Thanks for having us, Anthony. We appreciate your interest in kidney stones and that of the National Kidney Foundation.
I'm glad to be here today.
Yes, thank you so much, Anthony. Appreciate you inviting us and glad to be here.
Good. Well, thank you all for joining me today. Really appreciate it. So I think I'd like to begin with you, Dr. Palese. Can you set the stage for us and describe what kidney stones are?
Absolutely. And I think the way you said it, that the most searched term on your website is kidney stones. Well, same with Mount Sinai in the urology department. Kidney stones are very common. We see them in all walks of life, every type of patient you can think of. But what exactly is a kidney stone, I guess is what you're asking me. And so, the thing they think about kidney stones, everyone thinks of an actual stone. Well, a stone is actually what this looks like. It's a hard deposit. It's generally made of something like calcium oxalate or uric acid. There can be lots of different reasons why people get kidney stones, from genetic factors to dietary reasons, lack of exercise, body habitus, certain medications, even surgeries that they have. And so there are definitely different risk factors that people have that can lead to the formation of kidney stones or kidney crystals that then can form into stones later. They're called kidney stones while they're in the kidney. Once they reach the ureter, they're called ureteral stones. And eventually, if they make their way all the way down to the bladder, they can form quote unquote bladder stones and sit there until we actually go and take care of them.
Thank you. Dr. Goldfarb, we'd love to hear from you a little bit. Maybe we could discuss, how are kidney stones treated? And most importantly, for those who suffer from kidney stones, is there anything that people can do to prevent stones from occurring?
Right. Anthony, that's an important question. Let me just point out, when you ask how you can treat kidney stones, the difference between Dr. Palese, a urologist, and me, a nephrologist, we are involved in different parts of this process, right? So Dr. Palese is the guy who could remove a kidney stone if it was not passing on its own. And that's what urologists do. The nephrologists are interested in prevention. We're the non-surgical doctors of kidney stones. We're really interested in prevention. So that your question about prevention is really what I do for a living, right? And the things that we talk about, of course, are more fluids, increasing fluid intake to dilute the urine and dilute all the stuff that's in there that can form kidney stones, changing diet in order to change what's in the urine and the risk of the salts crystallizing in there and forming stones, and then prescribing medications and supplements to help change urine chemistry in order to prevent kidney stones.
Excellent. Very helpful. Thank you. So why don't we turn to Art at this point? Art, we'd love to hear a little bit about your experience and what were some of the things that you first did when you were diagnosed with kidney stones?
Thanks very much, Anthony. When I was first diagnosed, they weren't quite sure what it is I had. I had pain in the groin area and lower back. After several visits and CAT scans with a urologist, I was diagnosed with stones. I underwent a procedure to have the stones removed. First, let me say the methods to removing the stones have improved tremendously since I was first diagnosed back in 2001. And thankfully, with Dr. Goldfarb's help, I've been able to manage my body and my intake and prevent additional stones from forming, although I have had over a dozen stones. It's not a pleasant experience, but one with the right care can be avoided.
Good to know. Okay. So maybe that leads us to our next question, Dr. Palese. How are stones actually diagnosed? How would someone present to you, and how would you diagnose that problem as a kidney stone?
So great question, and again, wanted to just reiterate that my job, or what I do, is more of the surgical side, while Dr. Goldfarb is more of the medical side. And honestly, I can't do my job without someone like Dr. Goldfarb, and vice versa. We sort of have a very symbiotic relationship when it comes to kidney stones, because when the kidney stones show up, generally they're not showing up with an invitation. They're showing up sort of the worst time, the worst period you can think of. You're on a plane, you're on vacation, you're at a party. Because this is exactly when kidney stones like to lock on the door, and so this is what we always worry about. And those patients who have been fortunate enough to have a kidney stone on a regular basis, and it sounds like Mr. Aronson over there has had 12 already, and I don't envy that whatsoever. And it can be really difficult. For males, we call it male childbirth, since we really don't get to experience what women go through. But for men, certainly male childbirth, if you talk about a kidney stone, probably is an accurate term for that. So obviously the first presentation is usually pain. It can be also coupled with hematuria or blood in the urine. Sometimes even pressure or a dull ache can start. Sometimes even a urinary tract infection can be one of the first signs of getting a kidney stone. In general, the Cadillac of all tests that we use is a CAT scan, a CT scan. We are able to diagnose vast majority of stones. There's a small portion of stones that can't be seen on CAT scans, but for the most part, pretty much all kidney stones can be diagnosed that way. Ultrasound can be used. MRI, which is not a great test for kidney stones, can also sometimes pick up some of the side effects of a kidney stone, whether it's swelling or inflammation. But those are usually the most common ways to do that. Traditionally, an X-ray, a KUB X-ray, if there's enough calcium in the stone, you can actually see the stone on just a regular X-ray film. And so, with that information, we'll then determine whether or not a patient actually needs surgery, or we can monitor the patient, sort of do what's called active surveillance, where we have them hydrate, take medications, and also maybe even some medications to dissolve the stone. Dr. Goldfarb would be sort of following up a lot of the care for these types of patients as well, making sure we adjust their diets, making sure that we make sure their blood pressures are okay, their body weight is in check, that they get enough exercise. And so again, depending on the situation, it would determine what the next step is.
Good. Very helpful. Thank you. So that leads to, I think, a good follow-up question for Dr. Goldfarb, which would be, what kinds of problems can kidney stones lead to? And do they potentially raise the risk for additional types of kidney disease?
Yeah, that's important. And of course, because the National Kidney Foundation is so interested in chronic kidney disease, I think that's really an important thing to recognize, that kidney stones are a cause of chronic kidney disease. Most patients will have a slight decrease in kidney function at the time that they have an obstruction. And most of the time, if that obstruction is short-lived, and thanks to urologists like Dr. Palese, that is true. But sometimes it's more prolonged, and you can lose a little bit of kidney function. So there's a decrease in kidney function associated with kidney stones. But there are a lot of other interactions that are important to point out. For instance, overweight is both a cause of kidney stones and something that can lead to diabetes, and diabetes is associated with more kidney stones. Kidney stones then can be associated with loss of bone density as well. You think about calcium stones, the calcium is coming out of the urine, partly because it's lost from bone, or partly because there's something wrong with the kidney, and that affects bone density. So we're definitely interested in bones and stones being interactions. And then the other thing that's really interesting, it's not really well understood, but kidney stones are associated with vascular disease, and that kind of blood vessel problem might be due to calcium deposits in the blood vessels related to the way calcium deposits in kidneys. So there's definitely a slightly higher risk of heart attacks and strokes in people with kidney stones. So there are a lot of interesting interactions in both directions. Kidney stones causing other problems, and other problems, comorbidities, as we say, associated with kidney stones.
Thank you, Dr. Goldfarb. Art, I think that brings us to you in terms of, we'd love to hear, are there specific things that you're doing to maintain your kidney health? And what are you thinking about as someone who chronically suffers with stones?
So I undertake a few different things on a regular basis. First of all, I drink plenty of fluids. Dr. Goldfarb recommends about 96 ounces of fluids a day. I think I drink more than that. I take some medication. Part of that is Moonstone Nutrition's drink, which helps me keep my kidneys in balance. I also make sure I'm taking the other medications that he's prescribed. I watch what I eat. There's a particular diet to take things that have less salt in them and less foods to prevent kidney stone formation. For example, I don't eat spinach. I don't eat green beans. My wife and I, are very particular on where we eat and what we eat. And I exercise regularly. I'm a regular gym goer. In the pandemic, I've been using my Peloton because I'm not going to the gym. But for the most part, I'm out and about every day, making sure I'm drinking and taking care of my body via exercise.
What an excellent patient, Art. Excellent.
Nothing like a good adherent person, right?
I love it.
So maybe to switch gears a little bit, because we know that despite some of the best preventative measures, sometimes stones do recur. Dr. Palese, could you talk a little bit about what some of the surgical procedures are in treating kidney stones and when they're used?
Absolutely. So there's really 4 categories for surgical clearance of stones. The classic one that people always think about is the shockwave lithotripsy, or when people ask, "Oh, do I have to sit in a bath? Or do I have to go into a bathtub of water to do that?" Well, that was the way we used to do it back in the 60s and 70s, and luckily that's not the case anymore. It's really ultrasounds that we're harnessing to kind of focus the energy on the stone itself. There's a whole different variety of machines that are available. They work about 50 to 60% of the time, depending on the stone composition, the size, the body habitus of the patient. There have been some newer sort of developments that have made the procedure a little bit more effective. But in general, it's about a 50 to 70% effectiveness rate. So a lot of patients like that because there's no cutting, there's no invasiveness to it. It's all done from the outside. And so we'll sometimes start with that procedure in certain patients, especially ones with a softer stone or softer variant. The second procedure, well known, is something called ureteroscopy, where we actually take a scope inside the bladder up into the ureter with either what's called a semi-rigid or a flexible scope. So we navigate kind of like plumbing. We go up into the urinary tract. We find the stone. We use a laser. We break it up. We then pull out the fragments and hopefully get you stone free. You will sometimes require a stent after that procedure. There's a little tube that connects from the kidney to the bladder. It's in there temporarily just to allow for better drainage while there's a lot of swelling. That can sometimes be a source of pain for a lot of patients. I'm sure Art has also probably had his share of stents, as most kidney stone patients have. And so that's a fairly common procedure as well. I do quite a bit of that. The third way is something called a percutaneous nephrolithotomy, or PCNL. It's basically where we go through the back, where we actually make a little hole into the back area, removing the stone that way. That has also changed. The technology's changed a little bit over the last few years as well. There are something called mini percs, where we do it through very small incisions. But nevertheless, I mean, the whole process is instead of making a big incision or a big sort of old school incision, doing everything through small percutaneous incisions with video cameras and a laser and certain procedures, certain equipment that actually breaks up the stone. There's one in particular that I love using. It's sort of like a jackhammer and just breaking it, just like we think of cement. So, I get to play video games when I go to work. And then the last thing is sort of a newer area that we've really started to develop a lot. It's robotic pilolithotomy. So very, very large stones that just would not clear or won't be cleared with normal means, where even a percutaneous approach may be too big for the stone. The stone may be too big for that approach. And so in which case we go in with a robot with little incisions about 1/2 inch each. We literally make a small incision in the kidney, pull out the stone, sew it back up. The whole process can be about a 45-minute procedure, an hour at the most. And I'm doing quite a few of those now too for some of these very large, what are called staghorn calculi, these big stones that are kind of stuck in the kidney that just won't be cleared very easily otherwise. So really 4 major surgical approaches. Each of them sometimes can overlap. Sometimes we use a combination of the two. But in general, we can get most patients stone free without having to do sort of the old school big incision on the side, cutting through the rib cage, getting into trying to find the kidney. That was something that used to happen back, in the 60s and 70s. It's very rare now. Most of these procedures are done through a minimally invasive approach.
Excellent. Good to hear that technology is evolving in a way that makes these things a bit easier.
Absolutely.
Dr. Goldfarb, would you mind talking a little bit about some of the non-surgical treatments? So specifically what medications are used and things like that?
Yeah, so Anthony, as Art pointed out, I'd start with fluids, increasing fluid intake, modify the diet, and then if you still get stones after that, then we'd prescribe medications. The medications that I often prescribe, first, potassium citrate. Citrate gets into the urine, combines with calcium, and prevents the calcium from binding to oxalate. Most stones are made of calcium oxalate, as Dr. Palese said. So citrate is an antagonist of calcium oxalate precipitation. Citrate is easy to get into the urine from that point of view. The other thing that citrate does, it gets metabolized by the liver and turns into bicarbonate. Bicarbonate is base or alkali, and that's something that increases the pH of the urine, alkalinizes the urine, and that's good for dissolving uric acid and cystine stones. Those are less common than calcium oxalate stones, but it's another reason why citrate is often prescribed. So it's very unlikely that you can get out of my office without a prescription for some potassium citrate. It's generally, universally used for kidney stones. The other medication that I use quite a lot of is thiazides. Mm-hmm. Thiazides are drugs like chlorthalidone and indapamide. Some people use hydrochlorothiazide. These are medications that people think of them as diuretics, but I don't ever think of them as diuretics when I'm treating patients with kidney stones. They're not being taken to increase urine flow. They have a magical effect to reduce the amount of calcium in the urine. The calcium doesn't go out in the urine, and you get fewer kidney stones. Where's that calcium going? It's generally going into bone. So people who are taking thiazides for prevention of kidney stones will actually have an increase in bone density and fewer fractures. So remember I said that decreased bone density is associated with kidney stones. So that's an advantage of taking thiazides. Thiazides also lower blood pressure. That's one of the reasons they are very commonly prescribed. So sometimes when we give it for people with kidney stones, we think of that lowering of blood pressure as a side effect, but lots of people have that as a problem that is associated with more kidney stones. So very often using thiazides to lower blood pressure, reduce the amount of calcium in the urine, and increase bone density really goes together.
Great.
So that's what I wanted to say about the two medications that I prescribe most frequently.
Perfect. Thank you very much, Dr. Goldfarb. And guys, honestly, this has been an incredible conversation, really informative, and I think the viewers are going to take a lot from this. I think what we'd like to do at this time is take a minute to actually allow viewers on Facebook to ask some questions. So for the folks that are watching out there, if you do have any questions on this subject, please go ahead and post them in the Q&A chat section, and we'll do our best to answer as many as we can right now, live here on Facebook with our two experts and our patient expert. And if we do run out of time, all of your questions will be answered on NKF's Facebook page in the coming days. So let's see if we've got anything that is coming in. Okay, this is an excellent question. One that has come through first was, how has COVID impacted kidney stone management? So maybe Dr. Goldfarb, we start with you on that one.
I'm worried about getting a kidney stone as a result of all that time I was wearing a mask, not being able to drink and eat, So I know that I had a reduced urine flow from March through June. And I got to get an ultrasound to make sure I don't have kidney stones. Other than that, the big thing, of course, is telehealth, right? I've been doing prevention, and it's much easier for me to do my job than Dr. Palese can do his via a computer. But I've been doing a lot of, reviewing people's urine collections and that data, and I can send people diet handouts, and talk to them about their urine chemistry. And so that's the big thing that's happened. And of course, I welcome that. I particularly people out of state who consult with me. It's been easier for that from that point of view. And that's the biggest effect, I think. The growth of telehealth is something that's going to change American medicine for a long time, I think.
Yeah, we're certainly seeing that across, to your point, many areas. So, okay, of course, as expected, people are going to talk about, very specific lifestyle things. So, Dr. Palese, maybe you give this one a shot. Is coffee bad for kidney stones? As one part, and then the second part of that question is, does adding milk help?
Good question. Well, so coffee is a diuretic. It's got caffeine in it, and by definition, a diuretic will dehydrate you. Caffeine and coffee itself, if you drink enough of it, certainly probably is not the best thing in the world for kidney stones. On the other hand, 99% of coffee is really just water. So, the main thing is really we want to drink more water as much as you can. The milk can, I guess, you don't want to restrict your calcium too much. So moderate intake of calcium is not a bad idea. So if you're restricting all other areas of calcium in your lifestyle, then probably adding a little milk to your coffee is probably not so bad. One rule of thumb I tell my patients is if they're going to drink something that they probably shouldn't, like coffee or alcohol, chase it with a glass of water. And so in that will kind of help to dilute out any sort of the quote unquote the bad humors from these other things that just make life fun. And so you can't just live your life in a silo the whole time. So with the good comes the bad, so to speak.
Okay. Anthony, can I add something to that?
Yes, please do. Yeah, absolutely.
I want to point out, though, that although caffeine, as Dr. Palese said, increases the amount of calcium in the urine a little bit, every observational study of coffee drinkers showed fewer kidney stones. And so there's like 7 or 8 decent observational studies. These are not studies where you give coffee to half the people and seltzer to the other half, right? These are just studies of asking people about coffee consumption. Every single study shows that coffee actually is associated with fewer kidney stones. So I think it's safe, and I don't ever restrict it. I agree with Dr. Palese's comment about dairy. More dairy usually associated with fewer calcium stones.
Excellent. Good to hear. Well, I guess if we do a part 2 on kidney stones, we'll have to hold it in a Starbucks.
Let's do that.
So I think a follow-up question, and Dr. Goldfarb, you've touched on this a little bit, but several questions have come through again around diet, and if there's a specific diet for uric acid stones.
Yeah, that's an important question. The biggest reason why people get uric acid stones is because the urine is too acid. It's too acidic. So to eat less acid basically means less animal protein. And that's really the goal, is to reduce the amount of animal protein. And when I say animal, I'm not just talking about beef. I'm talking about chicken, fish, you name it. If it's got, as one of my patients explained to me, if it's got a face, it's an animal. And so eating less animal protein means eating less acid, and that's good for uric acid stones. The other part of that is, since acid gets neutralized by alkali or base, the other goal is to increase fruit and vegetable intake. So citrus fruits in particular will actually alkalinize the urine. They start out acid, they get alkalinized then when they go through the liver. So taking in more citrus, melons, oranges, cucumbers, all those kind of watery fruits and vegetables are ways of alkalinizing the urine and dissolving uric acid. So less animal protein, more fruits and vegetables is the diet for uric acid stone formers.
Excellent. Good to know. Thank you. And the follow-up question, actually, Art, is for you, which is, Art, how do you manage your diet effectively to prevent kidney stones?
So I pay attention to the diet that Dr. Goldfarb just talked about. I try to eat less animal protein. I eat a lot of fruits and vegetables, oranges, raspberries. Really shouldn't eat raspberries or strawberries that have seeds in them. And I have some in my diet, but I try to stick with the melons, bananas, and a lot of salads.
Okay, excellent. Dr. Palese, this is more of a sort of a technical question. Can a stone that is not obstructing cause hydronephrosis? So maybe first for the viewers, what is hydronephrosis? And can a stone that is not obstructing cause it?
So hydronephrosis is a medical term for swelling on the kidney. Okay, and that usually means the swelling is internal. So it's where the collecting system is, where urine is made. The traditional thing that you look for when you see hydronephrosis is to see if there's an obstruction. And is that obstruction a kidney stone, for instance? And that is usually one of the culprits that we find that's causing that. However, you can have hydronephrosis without a stone, and that can be from, let's say, scar tissue or some type of a narrowing that causes that, or some obstruction from something else. And you can also have kidney stones that are what are called non-obstructing or don't cause hydronephrosis. The question is, can you get hydronephrosis with a non-obstructing stone? Well, by definition, if it's non-obstructing, it shouldn't cause hydronephrosis, but the hydronephrosis theoretically could be from something else. It could have been from a previous stone passage where someone has now developed scar tissue that is causing that swelling on the kidney. There are cases of where people get pseudo-obstructing stones in the kidney, where, for instance, a stone is stuck in what's called a diverticulum or a calyceal diverticulum, where there's a small part of the kidney that is being dilated, although the rest of the kidney looks totally normal. That's a rare condition, but we do see that. That can actually cause pain, and some patients will jump from physician to physician until we actually figure that out, that that's what's happening. So there are some nuances to this, but in general, a non-obstructing stone should not cause hydronephrosis.
Okay, good to know. Sticking with that line of more technical questions, Dr. Goldfarb, can a kidney stone cause protein in the urine?
Generally, I'd say probably not. Very little protein associated with it. If the kidney stone were there for a long time, and I don't mean a non-obstructing stone, I mean a stone that causing obstruction, decreased kidney function and some protein might be seen. But for the most part, there's really very little relationship between kidney stones and protein in the urine.
Okay. So it's safe to assume if someone has protein in the urine, it may be from some other cause then.
Most often, certainly, as I said, more diabetics, people with high blood pressure have kidney stones, and those are things that can be associated with protein in the urine.
Okay, good to know. So, Art, everybody keeps asking us, do you have specific advice for people with recurring kidney stones?
Drink plenty of fluids, see a great nephrologist, and pay attention to what the doctor says. But the key for me is drinking the fluids, taking the medicines that are prescribed to me, and keeping my body healthy via exercise. That's been my success in keeping from forming additional stones.
Excellent. It sounds like prudent advice for certain. And then I think the last question we have here is I'm sorry, did someone else? Okay. Yeah, so, okay, incredibly, it seems like we've actually run out of time. Not surprised. I want to remind everyone that in case we did not get around to answering your question, please do check on the National Kidney Foundation's Facebook page, where we will continue posting answers to the questions in the next day or two. Also, if you didn't have a chance to ask a question, but you would still like to, you can always call the National Kidney Foundation's toll-free helpline, which is 1-855-NKF-CARES. So please do reach out if you have additional questions. At this time, of course, I'd like to thank our sponsor, Moonstone Nutrition, for being very supportive in helping us to make this program possible. And I'd especially like to thank our guests, Dr. Palese, Dr. Goldfarb, and Art Aronson. Thank you so much for helping us to get a better understanding of kidney stones and lending your expertise to this really important conversation.
Thank you so much.
Anthony, thank you. Thanks for your interest in kidney stones, and appreciate the NKF caring about people with kidney stones like me and Art.
Thanks very much for letting me talk about them and for being a sponsor and helping us cure this problem.
Perfect. Again, thank you very much. And now, on behalf of the National Kidney Foundation, I'd like to wish everyone good health.